Hi, I'm Morrigan. I'm a former intern at Trauma Informed Oregon, and I want to chat with you a little bit about why trauma informed care for autistic people is important. As an autistic person myself, this is something that is very dear to me, and I hope that this tip sheet will give you some important guidelines on how to do that. In addition to what's covered in the tip sheet, something that is really important to keep in mind is just the importance of intersectionality when we're talking about autistic people, because as is the case with disability in general, there's a history of tending to focus on white disabled people. And this is the same with autistic people, that there's a tendency to focus a lot on the experiences of white autistic people who are also cisgender and who are fairly wealthy, and that it's important to remember that that does not serve the needs of autistic people who do not have those identities, and that in particular Black and Indigenous and people of color who are autistic are oftentimes extremely marginalized even within the autistic community itself, and are not given the attention and support that they deserve. And that it's important that when we're doing this work that we always remember to center the margins when thinking about who we need to be serving. And on that note, it's also important that it really cannot be understated how important it is to center the safety of BIPOC autistic people because of the high rates of police violence and other forms of institutional violence that they experience. And while the tip sheet touches on this, I feel like it's important to always remember to center safety in terms of how the services are provided, and thinking about how police have traditionally interacted with BIPOC autistic people, and to always like center the safety in that way. And another thing that's really important about providing trauma informed care for autistic people is to always respect and promote autonomy, because so many autistic people have had their autonomy restricted and taken away either intentionally or not throughout their life, whether that's through practices of seclusion and restraint, or through various forms of compliance training in youth, or throughout adulthood. And so it's always important to center autonomy and to remember that when someone has been in the circumstance of not having been allowed to give consent for various things that are happening around them or to them, that um, it might be difficult for them to learn how to consent at first. And so being as supportive as possible and making it as easy as possible for someone to express their preferences and to consent is very important in providing trauma informed care. And that autonomy extends to, of course, all aspects of a person's life. One of the most important things to consider is the fact that because autistic people experience higher rates of violence and abuse throughout the lifespan, that there's sometimes a response to that that is to try to protect the person by preventing them from having relationships. And while this might be done out of the best of intentions to prevent the person from experiencing harm, it's also important to remember that that in itself can be a form of harm if the person's autonomy is being restricted. And so it's very important to recognize that people have the dignity of risk and making decisions for themselves, and to provide support for them while making these decisions so that they are able to have the autonomy and the support that they need. And I want to recognize that might be a very difficult line to walk, and that it is extremely important work to do, just because of the complex history of trauma that a lot of autistic people have around denial of autonomy in this way. Related to that is also um, the importance of remembering to critique the medical model and the ways in which autistic people have been stigmatized, and the stereotypes that are applied to autistic people, um, both from the medical model and through a lot of media portrayals of autistic people, including um, by actors in media portraying autistic people who are not autistic themselves, that a lot of these things reinforce stereotypes in our minds of what autistic people are like when they are not actually based in the lives of autistic people or in autistic people's experiences. And so one way of addressing these stereotypes and the stigma that contributes to harm and violence is to remember to listen to autistic people, and especially autistic people who experience multiple forms of marginalization and not necessarily just what we see represented on the screen, and to pay autistic people for their time and hire them in positions, and to make sure that their voices are elevated. Um, And another important part of that is also centering the Sins and Ballads 10 Principles of Disability Justice in the work that we do. And I believe that if our work centered the disability justice, that we would be moving a long way towards providing trauma-informed care for our autistic people. Thank you so much.